Hello, my name is Christina and I'm a pediatric pharmacist here at Orlando Health Arnold Palmer Hospital for Children. I'm going to talk to you today about how to use rectal diazepam or Diastat, which is a rescue medication for seizures. It's important that all members of the family and the patient watch this video to fully understand how to give this medication so that everybody is prepared in an emergency situation. Diastat should be given as a rescue seizure medication if your child has seizure activity or clusters of seizure activity that lasts at least 3 minutes or is prescribed by your doctor. Seizure activity can look different for different patients and may present as full body shaking, shaking on one side of the body or one part of the body, or staring spells. The medication works by slowing the electrical activity in the brain to stop and prevent seizure activity. It's important to wait the amount of time defined by your neurologist before giving this medication because many seizures will stop on their own without the need for medication. The Diastat device has a few different parts. Here is the protective cap that covers the syringe and the plunger in the back. The dose display window on the side should show the dose that your child was prescribed, anywhere from 2.5 to 20 milligrams. The green ready band here at the top should also be visible because that means the pharmacist at the pharmacy had the dose correctly locked into place and it's ready for use. Before you leave the pharmacy, it's important to make sure that both the dose display window is showing the correct dose that was prescribed and the green ready band is visible and locked into place. The medication and supplies should be kept in a safe and easy spot to get to if you need them right away. If your child starts to have a seizure or show seizure activity, shout for help if anyone else is around and place them gently on the floor. Make sure to turn them on their side to ensure that they do not choke on any vomit, and if possible, put something soft under their head like a sweatshirt or towel to protect them from injury. At this point, start a timer and grab the emergency medication in case the seizure lasts longer than the designated time frame. To give the medication, first remove the protective cover off the tip of the syringe. Lubricate the tip with the included lubricating jelly by inserting the tip of the syringe into the lubrication packet. Remove the lower half of the child's outer clothing and underwear to expose their bottom. Separate the buttocks with one hand and with the other hand, gently insert the syringe into the rectum until you feel resistance. Count slowly to 3 out loud as you press the plunger until it stops. 1, 2, 3. Then count to 3 slowly while holding the plunger into place before removing the syringe. 1, 2, 3. Then remove the syringe and count to 3 while holding the buttocks together to prevent leaking of the medication. 1, 2, 3. After the medication is given, write down the time that the seizure started and the time that the medication was given. Make sure to always follow your doctor's instructions for when to call 911. If you have not received these instructions, be sure to discuss the emergency seizure plan and instructions on when to call 911 with your doctor. It is not recommended to give this medication again until 4 hours after the first dose, unless you are told differently by your neurologist or emergency personnel. The most common side effects of this medication include drowsiness, headache, dizziness, diarrhea, and rash. While it's very important to be aware of all these possible side effects, please remember that the benefit that this medication has by stopping seizure activity outweighs the risk of any potential side effects. If your child does experience any possible side effects, make sure that you tell medical professionals right away. Make sure that your child has the diazepam rectal gel near them at all times in case it is needed. Store the medication at room temperature away from young children and away from excess heat or moisture. Do not refrigerate this medicine or keep it in the car where it might get too hot. Make note of the expiration date when you first pick up the medicine and always have one available that is not expired. Take the Diastat rectal gel to an emergency room or give it to medical professionals that arrive in the ambulance so they know exactly how much medication your child was given. If you need to dispose of the medication yourself, remove the plunger completely from the syringe and point the tip over a sink or toilet. Then, replace the plunger into the syringe body, pushing the plunger until it stops. Flush the toilet or rinse the sink with water until the gel is no longer visible. Then discard all used materials in the garbage can. If you have any questions about what you learned today in this video, please talk to your nurse and a pharmacist can come discuss any medication-specific questions with you and your family. Thank you for watching. Goodbye.